Well, as ever, you've sent in lots of questions, reflecting today's changes, keen for some more clarity. And I put as many as I could to the public health expert, Dr. Bharat Pankania. Now, as you know, he doesn't speak for the government, but he has given us his guidance throughout this pandemic. I asked him for his thoughts, first of all, on the easing of the lockdown.
I regret to say, I think it is premature. If I may explain, even today we have had 3,000 new cases. That's 3,000 too many cases out in the community. Implication is we've got far more than 3,000 people infected and infectious to other people. Therefore, if we venture out into this fog where there is a lot of infection going on, we will generate more cases. Also, our testing and contact tracing, our momentum is not in place. Therefore, I feel this is a little premature to lift the shutdown.
OK, interesting. Well, we have had lots of messages from our viewers, and one is asking, when the initial 12 weeks are up, what next? That's Sue in Fairford. And Christine has primary progressive MS and says, can she now go out on a motorised scooter if she's careful?
So with respect to Sue, this 12-week shielding was never a tablet cast in stone, 12 weeks and no more. It was initial 12 weeks. And really, my answer is, in view of the fact that we've got virus still circulating in the community, I would continue to shield. You are likely to get infected, and if you get infected and you are in a vulnerable group, it could lead to a severe illness. Therefore, you must avoid getting infected. With regard to Our Lady with the progressive multiple sclerosis, I'm so sorry. You know, MS is one of these long illnesses that takes many, many years, and I'm sorry, really I'm sorry for you. Look, what you have to do is be careful. Just be careful to stay away from other human beings and other crowds, and that way you will hopefully not get infected. So that's the plan. Stay away from others who may infect you.
It might be then that you have the same answer for the next couple of questions. Rachel says, should all 70s be treated as vulnerable even without health conditions? And Angela and David are saying they want to stop relying on others. David's 80, they've been isolating, but they want to do their own shopping and stuff now. What should they do?
Again, the basic principle is human beings infect you, and places where human beings congregate are also sources of infection. If you can avoid both of these places, humans and crowds where humans have been, then you are in a better, safer position. The best one is to just stay away from all these places. But if you need to be out, these are the things to do. Stay away from humans, stay away from places where humans congregate.
OK. Lots of people are talking about schools going back. Joyce Johns asks, how safe are school environments if staff and parents aren't wearing PPE? And what measures would you want to see introduced in schools?
This is very concerning. Really, I'm very concerned about it. As a scientist, we do not know if children who may be without symptoms are still conduits, meaning they bring the infection home to their parents and their grandparents. We don't know. And in view of the fact that we don't know, I'm very concerned about schools reopening, very concerned. This thing about distancing and all those little, what we would call symbolic measures, they won't work. We need to have the science in place before we feel comfortable with opening the schools.
OK. There are some concerns in a similar vein about going back to work. If we're socially distanced in the office, asks Louise, does air conditioning mean that social distancing won't make a difference?
I think the two items are independent and unrelated. Having said that, we do know that there is probably, I'm not saying certainly, probably other means of transmission in crowded places as well. Therefore, if I were in that office situation, I would say, look, as a minimum, I would be wanting to wear a mask in that crowded office environment to protect my colleagues if I were infected, and my colleagues protect me by wearing a mask if they are infected. There is a lot of without symptom infection in people. So we really must be careful if you're going back to work or office settings. This is really important.
So keep all that good hand washing and the good sanitizing and everything else and this distance that we've learned so far. Obviously, we don't want to encourage anybody to relax any of that, do we?
Not at all. And even when we have advocated, and I have advocated this, that you wear masks in crowded places, it doesn't mean you're absolved of all those other infection control practices that you also must contain, must sustain, must carry on. This is very important. This coronavirus COVID-19 is extremely nasty piece of work. And the more I learn about it, the more I feel we need to be extra cautious.
OK, now somebody's asked, can people exercise more often, or now that they can, how safe is it for others to walk through the air left in the wake of an exerciser breathing heavily?
I think you're pretty OK with that one. I have come across this before, but in that outdoor environment, there is considerable instant dilution of air, and it's the droplets that I'm concerned about where the viruses are contained rather than the exhaled air. So exhaled air is exhaled air. It's the droplets where people talk, sing, shout, cough, sneeze. Those sort of environments I would be more cautious about.
OK. Well, as ever, thank you so much for your time and for chatting to us, Dr. Bharat Pankania.
My pleasure. Thank you.
Really good to chat. And thank you as well for sending us your questions. We always get so many. So I think that really shows that there's still a lot and a need to talk about these things, isn't there?